a change. Without taking much time, I request Dr. K. Madan Gopal, Advisor PHA NHSRC, Ministry of Health or Family Welfare, and former Senior Consultant NITI Aayog, to share his viewpoint. A big round of applause for him, please.
Thank you, Shovikji. Thank you, APAC, for giving me this opportunity to share my thoughts. Having seen the journey of the digital health in the country, I'm very happy that at least I can share something which I was part. And I've been hearing the previous speakers about the innovations which they have been doing. So all the things are more or less converging and moving in the right direction. That's the only thing which I can say. But one of the important things which always strikes me, because having worked at NITI Aayog, now working with now I'm walking the talk. I used to talk there, now I'm walking the talk. So I just usually feel that we are dealing with numbers. We are dealing with 1.4 billion population. Some of the speakers, they have mentioned about the access issues, how to increase the access. We have invested a lot into the infrastructure. We are having an infrastructure right up to a population of a section level that caters to a population of 3,000 to 5,000 population. We are having a health institution which is now called as the Health and Wellness Center. We have developed around 1.7 lakh, we do have 1.7 lakh Health and Wellness Center, which provides 12 assured services to this Health and Wellness Center. That includes mental, dental, and the cancer screening, NCD screening, apart from the reproductive services, immunization services, and treatment of the minor elements or the common elements. That service is assured from these institutions. Above that is the primary health care center, which caters to population of 20,000, 30,000 population. So we have created and invested into infrastructure. That infrastructure is available. To cater to the needs, to provide a continuum of care between these primary care services and the services for secondary and tertiary care, we have invested into AIIMS-like institution. Now we are having around 26 AIIMS institutions, which provides a little of secondary and more of tertiary care, apart from teaching and creating high-quality medical graduates. In a PPP mode, you have seen that how the universal healthcare is addressed that through PMJ. We have heard the additional CEO of this National Health Authority, which is rolling out this PMJ. That means the private practitioners or the private partnership is there in this PMJ program is equal. That is 50% of the institutions are public and 50% are private institutions. Having said this, that is having a health infrastructure, how to have a connecting link between this infrastructure. That is a digital means. We have created a digital mission also. When this PMJ program was rolled out, we were in a dilemma that what to do because in health, you may name a problem, you have a solution, you have an app, you have a program, you have a portal. But what to do with all this data which has been generated? The critical mass which Vasant Gash was mentioning, where is that critical mass? All the data portals are there, you name it, and they are there, but they don't talk to each other. So how to make them talking to each other? That's why this ABHA ID and embedment of this ABHA ID into the digital record, that becomes important. One task is to create ABHA ID, then the second task to take it further is embedment of this ABHA ID into the digital records and making electronic health records, which can be further used for creating or running machine learning tools and other things. For creating that, the challenge lies in how to embed that thing. Though we have created around 40 crore plus ABHA accounts, the embedment is very slow. How to create a record out of that so that we can at least have that information available and we can run some machine tools and other things to have some intelligence derived out of that. There's a challenge and we are moving in that direction. The other aspect is during the COVID times, we have very much seen that when the system was overwhelmed for 2-3 weeks during the second wave, it was the telemedicine practice guidelines which were released after the first wave, which has come handy to, and it has at least uh, saved us with lot of agony and other things, other catastrophe. You can't imagine that had it not been a legal sanctity given to the telemedicine practice, then you could have imagined what kind of situation we would have landed in. We were having in the National Health Mission, we were already having this tele consultation in the form of 104 services, whereas any beneficiary can dial 104 service and then get some consultation from the health system. What has happened, we have heard about the Uttarakhand, we have heard about Haryana Pradesh. But you see that in a very structured way, this telemedicine is being rolled out. That is known as the e-Sanjeevani program. It is rolled in the form of hub and spoke. We have around 18,000 hubs where the specialists, including the Ayush specialists, they usually sit there. And around 120,000 spokes are there. The Health and Wellness Center, which I have mentioned, that's the peripheral most health institution which is available. There also a community health officer is there, a mid-level service provider we call. He can connect to the hub and get the specialist services there. Because at that level, now we are providing 12 services. The person is screened. The person is provided free of cost medicines for hypertension and diabetes. In case of referral is required, a referral is there. But a consultation from the specialist is also being made available. The same kind of model is there in the urban areas also. I will not delve more into that. But before that, I will just like to have some challenges because it's being the last speaker. So giving examples would be just a repetition of what has already been told. I would be just citing some of the examples, some of the challenges which needs to be addressed. One of the challenges, interoperability and standardization of the data, because we have been all talking about data, but we have to see that whatever data, because in fact, even if I have a data embedded with the ABA account, whether that data would be interoperable, that kind of standards we have to set. The challenge which we are having, the data structure which are there in the different portals, whether they would be compatible with the information which is available, and if we, even with the common identifier, are we able to use that data or not? That's a challenge which we have to address. We have to create an adequate infrastructure as mentioned. That means we have to see that how the feature phones and other aspects, that the people who are not digitally literate. My colleague from NITI Aayog, my ex-colleague from NITI Aayog, she mentioned that the senior care would be a challenge. If a census happened, it would be around 13%. With a digital divide, you see how the behavior pattern of the senior citizens are there. Are they digitally empowered or not? We have to see that we have to create an adequate infrastructure and bandwidth along with security measures to address this population. That population is going to be vulnerable, and we have to see that. And increasingly, home care and the other care would be sought by these people, how to create an infrastructure and bandwidth for them. Internet penetration is there, but whether people are using it, whether they are having a wherewithal, or the things which have been mentioned, whether they can have an affordable smartphone which can be used by them. Then the other thing with the growing frauds and other things, there is a growing concern about the trust among the consumers. The moment you talk about any digital solution, the first question is, it will ask all the information from my mobile phone. It wants access to all the contacts, it wants access to all my messages, whether it is coming from bank or not, it will read all the messages. The moment it thinks, we don't know what happens to that information or the update. So that kind of mistrust is also been conducted. We have to see that how that awareness mechanisms and other things are being generated so that this mistrust is also addressed. And lastly is how we align and coordinate with the different people. The UPI and other things, it has become, the fintech has become a very is a big movement. Can we make a HealthTech also as a movement? That's a question which we have to ask. MedTech is not only patient, it's all the ecosystem of the patients. And we have to see that how we align all the ecosystem so that a coordinated effort is there. So a lot of work is to be done, and we see that how in the coming years, all the ecosystem is in place. We have to see that with our efforts and other things, how we take it to the next level. We have been talking about electronic health records. We had a vision of electronic health record way back in 2010-11 when we envisaged after the enactment of this Clinical Establishment Act that we should be having 1.3 billion electronic health records. Still now, that's a dream because unless and until the electronic health records are in place, whatever advanced learning or advanced intelligence software which you want to propose or build, you require data. And data, that too a critical mass of data. And that can only happen when you have electronic health records. So we see that how the ABA account creation are embedded into the records and the electronic health records. That's a journey we have to travel together and see that how we move in that direction. I will stop here. Thank you once again for this opportunity to share my thoughts. Thank you.
Thank you, Dr. Madan Gopal, K. Madan Gopal, former senior consultant NITI Aayog and advisor PHA NHSRC, Ministry of Health and Family Welfare. Always a pleasure listening to you because you always talk about the challenges. And our motto of organizing this conference has been that we not only talk about opportunities, but also we can talk about the challenges so that those challenges can be addressed and some fruitful work can be done in the real world. Yes, you talked about data standardization, connectivity, network, security, cyber security, how we can plug